Synovial fluid analysis. General considerations. Synovial fluid is a tissue fluid found in the joints and contains protein, mucin, secreted by synovial membrane. Normally the synovial fluid is clear, viscous, pale, or straw colored, and doesn't clot due to the absence of fibrinogen. Synovial fluid is formed from the component of blood supplied by synovial membrane and vascular network and is modified by endothelial lining, connective tissue, and synovial lining cells. The normal constituent of synovial fluid are meant to nourish the avascular articular cartilage. Synovial fluid also provides cushion and lubrication for movements of joints to minimize the frictional movements within the joints. Collection of synovial fluid. Synovial fluid is collected by joint puncture and aspirated by syringe. 5 to 10 milli synovial fluid is collected from large animals, while 0.5 to 1 milli synovial fluid is collected from joints of small animals. The site of joint puncture must be shaved, and usual antiseptics should be applied on the surface. Synovial fluid is collected in an anticoagulant like sodium citrate 3.8% and mixed properly to prevent coagulation. Indications to diagnose the cause of joint inflammation, pain, swelling, and fluid accumulation. Examination of synovial fluid. Examination of synovial fluid include physical, chemical, and microscopical examination. The physical or gross examination include color, viscosity, odor, and turbidity of the synovial fluid. This chemical examination includes the pH, protein, glucose, mucin, enzymes, specific gravity, and coagulation. The microscopical examination include total cell count and bacteriological examination. Physical examination. Number 1. Color. Normally, synovial fluid is colorless. Abnormal color include red color in case of hemorrhage, greenish yellow color in case of septic arthritis, white or milky color in case of crystals, as in cases of gout. Number 2. Transparency. Normally, synovial fluid is transparent. Synovial fluid is disturbed in hemorrhage, presence of crystals and bacteria, and increase in number of cells in infectious arthritis. Number 3. Viscosity. Viscous. Normally, synovial fluid is viscous. Drop of synovial fluid from a syringe needle will form a string a few inches long. Reduction of viscosity occurs in infections and inflammation. Odor. Usually the synovial fluid is odorless. It may become foul smelling in pyogenic infections of joint. From the above, normal synovial fluid is colorless, transparent, odorless, and viscous. Chemical examination. Mucin. Synovial mucin is an acidoglycoprotein which can be precipitated by acetic acid. Mucin test is used to detect inflammation of the joint. As the level of the mucin is decreased in case of inflammatory condition of the synovial fluid. 1 drop of 7N acetic acid is added to 0.8 ml distilled water in a small tube and mix it thoroughly. Then 0.2 ml synovial fluid is added in such a way that the fluid doesn't come in contact with glass of the test tube. Mix the fluid thoroughly by swirling and allow to stand for 1 hour at room temperature. Interpretation: normally, a tight ruby clump in clear solution is formed. A soft mass in slight turbid solution means fair. A small friable mass in a turbid solution poor. A few flakes present in turbid solution very poor. Normal synovial fluid contain a tight ruby clump, at the center. The presence of turbidity or flakes indicates inflammation. Protein: normal synovial fluid in bovines contain albumin, alpha, beta, and gamma globulins. Protein increased with bacterial infection. Glucose: glucose typically a bit lower than blood glucose levels, may be significantly lower with joint inflammation and infection. Specific gravity of normal synovial fluid varies between 1.010 to 1.015. In joint diseases, the specific gravity of synovial fluid increases due to presence of large number of cells. Coagulation: the synovial fluid doesn't clot up to 2 days under normal conditions at 4 degrees centigrade. However, in pathological conditions of the joint, it may clot within 15 minutes to 3 hours, depending on the severity of inflammation. For the formation of clot of the synovial fluid, from 15 to 3 hours indicates the presence of inflammation. Alkaline phosphatase and other enzymes: the level of alkaline phosphatase in synovial fluid is much lower in comparison to its serum levels. Lactate dehydrogenase and alkaline phosphatase increased level may be seen in infectious arthritis or gout. Cytological examination: normal synovial fluid has a small number of white blood cells and red blood cells, but no microorganisms or crystals present. Cells in the synovial fluid can be examined by centrifugation of a sample to concentrate the fluid cells at the bottom of a centrifuge tube. Samples are placed on a slide. Drops from the sediment are placed on a slide and treated with a special stain, and an evaluation of different kind of cells present is performed. Total cell count, number of WCs and red blood cells in sample can be performed using the hemocytometer. Increased white blood cells may be seen with infections and with conditions such as gout and infectious arthritis. A white blood cells differential determines the percentage of different types of white blood cells. An increased number of neutrophils may be seen with bacterial infection. This slide shows the white blood cells in sediment from the synovial fluid